If you're taking care of a loved one and you need some extra help, stay tuned and listen to AARP Real Possibilities. Thank you for watching AARP Real Possibilities. I am so thrilled to bring to you our guest today, Dr. Deborah Moerland. And today we're going to be talking about home care and how to expand your options when you have to make some tough decisions. Hi, Dr. Moerland. How are you?
I'm doing well. How about you?
I'm doing great. It's so good to see you again. And you have been on quite a journey over the last few years or so. And tell us, first of all, when we're talking about FirstLight and home care, what are we talking about in terms of home care? What does that mean? That word, what does that even mean, that terminology?
Well, home care is for people who are needing additional assistance in their homes. And it can be from anything from companion care to cleaning to med reminders to dementia care, even people who need assistance with transfers and showering and dressing. We do all of that.
And that's incredible because people many times don't realize they have those kinds of options when they need help, whether they're working, the caregiver's working, or they need to get out of the home, or they can't do it all on their own. There are options out there available for them. But before we get into talking about some of that, your background is actually fantastic and phenomenal. You didn't start talking about, you didn't start your career in this business. So talk a little bit about how you got from teaching math to doing home care and why.
Well, I started out teaching in high school in Chelsea, and then I did that for 14 years along with teaching at Lansing Community College. I was teaching math online there, and I started doing a lot of online teaching. Well, I kind of got burned out with just online teaching, and I decided I wanted to do something more to help the community and be out and talk with people and not just on a computer. So I started doing some research, and I chose FirstLight because of the amount of training, and I did not have a business background or any medical background or any home care background, so I figured training was the most important thing.
And that in itself is really a message. We could do a whole show on that, just re-careering, how you can find other options when people out there thinking, I'm stuck. You're not stuck. There's always something else that folks can do, and look at other careers and just have to take that plunge and do it. So now you are the owner of FirstLight Home Care, and you talked about the services that you do in the home. What does it take for someone what do they need to do in order to access those services? Is Medicaid, Medicare, pay for any of those services? Is it private funded? How do they know when they even need them?
Well, most of it is private funded, unfortunately. Medicare does not cover private duty non-medical home care in the state of Michigan. It does cover it in some other states, but not here yet, but hopefully someday. Medicaid really is not much of an option unless it's a private individual working, and so most of it is private pay or long-term care insurance. We also work with the VA, and many other companies do as well, but veterans have benefits that they don't even know about, and they can have home health aides, they can get respite care through the VA, so it's really a good opportunity for them to look into when they need help.
One of the things that we hear a lot from older adults when someone's coming into their home to help them is the trust factor. Have they been vetted? Someone can't find their earrings and they swear that the person who was providing the care took their earrings. How do you vet your employees and your helpers, and what do people need to know to look out for when they're looking for someone to come into their home?
Well, we do a background check, and then we also do a drug test. And we do reference checks. And obviously nothing is 100%, but we have a pretty good track record. Some people will put cameras in their homes, which, we welcome. We want, we let the caregiver know. But really, we haven't really had too many issues with that. Most people who get into this field care about the people they're taking care of.
And that's another question too, people getting into the field. You need more direct care home workers, right? I mean, the whole industry is looking for more people to have that passion. And they can have that passion, but they're just not getting paid enough.
Right.
And so you talked about some of the services that are offered. So can someone have you come in is there a minimum number of hours per week, per month? How does that work?
Well, agency is a little different. I do think most are requiring a 4-hour shift now. Some require, 4 hours, 5 days a week, or a minimum number of hours. We just require 1 4-hour shift a week, and we just want to be an assistance to people. People can get a 4-hour shift in the morning to help them get up. They can get a 4-hour shift at night to help them get ready for bed, have dinner, all of that kind of stuff. And some people will do 24/7 care. So we're in the home 24 hours a day, 7 days a week. And of course, that's with 5 or 6 different people, but it works well.
And so when you go into the home and someone needs some help, how do you build that relationship? Because, if they don't know you, the stranger come in, you're helping me get up, you're helping me to bathe, you're helping to turn me. What do you do to help build the relationship between the worker and the person needing care?
Well, first of all, we do an in-home assessment, and all agencies do. And we try to find out as much as we can about the individual, not just about their illnesses, but what did they do previously? What are some of their activities they like to do? We want to fit a caregiver as closely as possible to their needs, specifically for the physical needs. Then we say, okay, well, this person likes to play euchre or whatever. So we try to, maybe even teach the caregiver how to do that. But we always do a meet and greet in the beginning, and that can be before the shift is even starting, or it can be at the first shift, and I often go to those, or our care coordinators do.
And you talked about the vast array of services that are offered. You even said cooking, and share that list again of all that. The list, just some of the things that people, you don't think about that. You think about people need, more medical types of caregiving, but sometimes they just need help with activities of daily living. Right,
right. So let's take a typical day, and we have a person who needs help getting out of bed. So our caregiver will show up at the time that they're supposed to be getting up. They will help them transfer to a wheelchair, let's say, get them in the shower, get them dressed, get their breakfast for them, remind them of their meds, and do any cleaning that needs to be done, do the laundry, change the bedding, just make sure that everything is good in the home. And then throughout the day, sometimes the client will stay home for 4 hours on their own, and then we come back at the evening time and go in and make dinner, do some activities with them before they go to bed, make sure they're in bed safely, and then leave. Other people might need 24/7 care because they get up in the middle of the night, they fall, and they need somebody to assist them to walk to the bathroom is all. But that way they don't have to go anywhere else. They can stay in their own home.
AARP's research has shown over and over again that people want to age in place. They prefer to age in their own home, and they just need a little extra help sometimes in order to be able to do that. And I think the number is something 1.7 million unpaid family caregivers in the state of Michigan. So there are a lot of people out there needing who are providing care. What kind of respite for people who don't have this service? Do you have any suggestions, ideas of who can do to take care of themselves if they are a caregiver? I mean, they can call some kind of a home service. We know that would be helpful. But if they can't afford to do that, what do they do on their own? How do they take care of themselves?
Well, I do know that many people have different family members coming in, but everybody needs to remember that they need a break. Taking care of someone 24/7 is very stressful. If it's a spouse taking care of somebody else or their loved one, then they often decline as well because it's just too much for them to keep up the house, keep up helping that other person who needs additional care. And so it's good to obviously call a home care service or maybe even a friend to see if somebody can stay with them. We have one person that likes to golf 1 day a week, so we go 6 hours so that person can get away and do their golfing. And it may sound, trivial, but that time away is a great relief for that person, and he's doing so much better.
It's great. They're both doing better, obviously.
Yes.
Then, yes. And it's the socialization, too, having someone else come in for the person who needing the care to have someone else to talk with is helpful for them as well.
Oh, right. Definitely.
What's the number one service that's requested? Is there one top 2 or 3 services that you get most of the time? They want you to come in to do what?
Mostly we have dementia clients. A lot of people have dementia now. And so we spend a lot of time with the dementia clients, and that includes helping them with their personal care because they obviously can't remember how to do some things. So that is our number one service that we provide. And so our caregivers go in and they often have to redirect. We use music to get people to calm down if they're in one of those moods. And music is so incredible to people. It is amazing. One person we've had did not want to shower. He had not showered in weeks. And my caregiver went in and talked with him. His wife had been so frustrated because she could not get him to get a shower. He turned on some music and walked him into the bathroom, and he took a shower. And this all happened within a half an hour after she had tried for weeks. So if somebody's struggling with somebody with dementia and what they need to do, having a caregiver come in can help teach them some new techniques that they can use as well to help reduce their stress.
Yeah, I think music has medically even been proven to be such a stimulator, brain stimulator for folks who have been somewhat lethargic or just in a catatonic state even, and then they play certain music that they were used to listening to. So that's an excellent example. What else? Patients with dementia, just going golfing. You get a lot of cooking requests, and can you come cook even if you don't have a caregiver?
Yes, we actually have had people just use us for meal prep because they were ordering out all the time and eating the bad fast food. So we would go in and prepare meals for the week and then put them in containers in the refrigerator, and all they had to do was warm them up. So it's a food service as well. We sometimes also do transportation to appointments for clients. So the family members have work and they're not able to take them all the time. But what's good about having a caregiver do that is they don't just drop them off and leave. They stay with them. They know what's going on at the appointment, and they can relay that information to the client's family.
Very nice. And that allows people to continue to work or to stay doing recreational things that they enjoy doing as well. If someone's listening and they think, okay, I want to look at a service, a home care service, what should they look for? I mean, there are shysters everywhere, so what kind of certification, credentials, background experience should they look for?
Well, years in service is a good thing to look at, as well as, a national franchise, because they have quality controls in place. And technically, even though we're not accredited at this point, we're working on that, we follow all of the guidelines to be accredited. So, and making sure that they have, a background check as well as drug testing to be sure that we're getting potentially really good people in the home. So, and we try to hire people with experience, but we can also train new caregivers because a lot of it is cleaning or driving somebody or, just helping them stay independent. But if they need to learn more, then we work one-on-one with that person in the home. So,
what's I don't know if there's an average age, but tell me about the person, the helper, the caregiver who goes in there. As a younger person, what are you seeing in terms of the average age? Is it middle age, older? Because there are people out there looking for jobs who have a passion for older adults, or for people who just taking care of folks, or like you, might have a PhD in math and end up wanting to do some work in caregiving. What are you seeing in terms of that profile?
I see a lot of single women, mothers. I see we actually have a caregiver right now who's getting close to 80 years old, but she has a passion to help people. So we give her clients that she can actually work with. And we've had several people in their 70s. We tend to get people usually in their 30s. But we can work with anybody. We've even had people just getting out of high school, starting college, and if they're going to school for nursing or physical therapy, this is a good opportunity for them to learn how to work with people and not just learn the skills.
Yeah, excellent. And again, people don't always realize that they have choices. And nursing homes got a pretty bad rap during the COVID, and we understand the disease and the the percentage of people who contracted COVID in nursing homes was just off the chart. This is an option, but talk about the options between long-term care facilities, short-term care facilities, in-home care. Can you talk about the differences in those and how it can be beneficial to people just to know what choices they have out there?
Well, the biggest benefit of having home care is it's one-on-one care. So somebody staying in their home and having that individual help them all the time is more beneficial than an assisted living in some cases. So it just depends on everybody's situation, and assisted living is more expensive if there is not a lot of extra care needed. So for example, if somebody needs 20 hours a week of help, that's going to be less expensive than putting someone in an assisted living or a nursing home. So I think cost and value tend to go towards home care, but many people don't know that that option exists. In the same way with when somebody gets out of the hospital after surgery, they automatically think they must go to rehab. And they could go home, have rehab come to them, and then they're going to recover a little bit quicker.
In their own environment. So let's talk a little bit, just generally, if someone wanted someone to come in, a caregiver to come in 10 hours a week, let's just say 10, what would be the range of cost? I know it depends on services that they're doing. If they're doing everything, then that's one price. If they're doing, there's something like you were saying, getting up in the morning, helping them to get going, just the range. What could you expect? What could they expect to pay?
Well, in this area, the average cost is anywhere from $32 an hour to, I would say, $40. And it varies on each company. It also depends on the services, and it depends on the amount of time. So I know some people charge more for fewer than 4-hour shifts, but many companies can no longer do that because the cost of transportation, so the gas and everything, and it's not even worthwhile for a caregiver to go work for a 2-hour shift. So I think most are tending to be at 4 hours, and they're right around 32 to 35 in general.
Good. And do you get the same caregiver every time? Like if you're doing, I know you said 24/7, you might have different caregivers because that's a lot for people. But if someone's doing a 20-hour a week, would it be the same caregiver coming in for that 20 hours?
Usually, yes. Unless they call off because they're ill. We do have office staff that can cover shifts. I have covered shifts, but I tend not to anymore. It's just too much to keep going. But in an emergency, I have done that. And we want to make sure that everybody is well taken care of. And if there's a call off right away, we communicate immediately with the client to let them know somebody's going to be coming, but they may be a little late. But things happen. Somebody might be in an accident on the way to work, which has happened. They get up and then all of a sudden they're sick. And during COVID, we had a lot of issues with, oh, well, I've been exposed to COVID, so then we had to figure out something quickly. So I'm glad that's kind of settled down now.
There's, you mentioned the age range from right out of high school or college to an 80-year-old who just loves taking care of other people. What do you see if ARP's work to look at increasing the pay for caregivers and also looking at some kind of a career ladder for them? So you have a background in education. What do you see as a stepping stone for someone who might be interested in starting their career there or just getting that experience? Is there a credential that they can get? Or what's the career ladder for someone who's a caregiver?
Well, currently we have a Going Pro grant for a CNA, and we actually have 3 of them, and it's
certified nursing assistant.
Yes, and it's an apprenticeship program that we're working on, and we will be doing it through Lansing Community College.
Oh,
and we do have we will be having 3 individuals who are 2 who are current employees and 1 new employee going through the program to become an assistant care coordinator. It's not really the technical name. We're trying to get the right name for the Department of Labor, but it is an opportunity for them to do some of the administrative tasks, such as doing the supervisory visits, learning how to manage other people. So from there, they can move up to a care coordinator at some point, or after a year working for me with that credential, they would most likely get an administrative position somewhere else.
That's great. I mean, because people think about that, right? They want to. It's such a admirable position for someone to have a heart to take care of other people, but they get burnt out as well. And just being able to have some kind of a career plan for them to be able to do something else and be able to train some other folks to come into the field is admirable. When you go into a home, and we talk about this a lot, home fit, having the home ready for people as they age. And sometimes it applies to young people with children as well as to older adults. So in the minute and a half or so that we have left, talk about how people can prepare their home to keep it safe for those who are they're taking care of.
Yeah, the number one thing is making sure there are no loose rugs all throughout the house. A lot of people like those. They look nice, but it is a fall risk. It potentially can cause somebody to trip and get hurt very badly. We go in and do a home safety check. We make sure they have smoke alarms and carbon monoxide detectors, as well as a fire extinguisher. We make sure that the doorways are big enough for the wheelchair. Sometimes we recommend a hospital bed, grab bars, as well as a shower bench to make sure that they stay safe, because many people do fall in the shower or in the bathroom.
So those are things that people can do even before someone needs care. I mean, just to kind of retrofit your home to, if we're fortunate, all of us will age and all of us will live a long, 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 long life, but you want to live and age in place. And those are some of the things that will help. So we've got about 30 seconds left. Tell us, folks, whatever you think they need to know as we close out this program.
I think if you have somebody who is struggling with doing their daily activities at home, it's worth a conversation with a home care provider to see if it is a good fit for them to come in and work with them and help keep them safe during their time of need.
Absolutely. And the dignity and the respect that they have, that when you stay in your own home, you're not one of many. Like you said, the one-on-one direct care is just, it really helps you to maintain that dignity and respect and self-respect as well. And it helps the caregiver or the loved one get a little bit of respite care as well. So
yes, definitely.
Thank you for the service that you're providing. Continue. I hope you don't grow weary in well-doing and that you continue to find the kind of workers that will help make a difference in the lives of other people. Thanks so much for being here. We appreciate you.
I'm joined with nurse practitioner Marie. Marie, I got a question for you. What really basic and easy things can people do to improve their health quickly?
All right. Well, Dr. June, some basic things you can do in our everyday lives to improve our health are first exercise. Exercise is important. Walking is one that's very easy to do. Getting in about 30 minutes a day improves our health greatly. Drinking more water, it's important, just staying hydrated and avoiding, the buildup of toxins in our body. It's important as well. Eating clean, avoiding fast foods, eating the rainbow, more fruits and vegetables, that's important as well. And on the more basic even level, brushing our teeth is also very important. Just, staying healthy and avoiding, any potential bacterial infections in our mouth, and that's good as well. So those are just a few that I can say. There's a lot more, but just to name a few, those just are the ones I can think about.
All obvious things like smoking, and avoiding smoking, and not just regular cigarettes and cigars and tobacco pipe, but e-cigarettes and vaping too has been shown to be very dangerous as well.
Absolutely, I agree. We all remember all the teenagers, I think in the past year, who were having issues with collapsed lungs in hospitals. So vaping is absolutely bad for you. So I wouldn't vape.
All right. Yeah. Any other really easy, simple tips that you can give for pretty much quickly improving one's health?
Staying on top of your physical exams with your doctor once a year. That's important.
I think that's very good advice.
Yeah. Yeah.
Stay up with your primary care.
Yeah.
Thank you.
You've given us good advice on what to look for when we find an advisor. So tell us today, how do we prepare? Let's say I finally found my advisor. What do I prepare? What do I need to have in place or in hand when I meet with my advisor?
First of all, congratulations on making that first step. I think what really, the first expectation to have when finally getting to meet your advisor is, the preparation. Be prepared to really share a lot of your information with this advisor. First of all, you've made the decision to trust this individual, and so you want to be able to share. The only other profession I feel where you can get this intimate with is probably your doctor, where your doctor needs to know everything about your health situation before they can make a diagnosis or really put a plan of action. And the same is true with financial planners. Financial planners, you want to make sure that they know everything, all the details, all the nuances of your personal individual life when it comes, as it pertains to money. And so I would say you want to start off with a balance sheet. Look at your assets and your liabilities and try to have those in preparation for your meeting. Look at everything that you owned, all your assets like I mentioned, all the liabilities that you might owe, and those are important details that you want to hand over to your financial planner. In addition to that, look at your cash flow. What type of monies are coming in? Is it just your salary? Is it just, interest and other things that are coming in? And also, lastly, you want to look at all the other little gray areas in there, all the benefits that you might have from your work, any insurance that you might have. In general, you want to have a holistic picture that you present to your financial planner.
Excellent, wonderful advice. So many times people don't think they're going to live as long as they live. And people are living longer than ever. So you need to look at how long, the quality of life you want, right? Absolutely.
That's a good frame of thought to have, is going into the meeting, you want to make sure you understand from your own perspective, what is it that you want? That question is going to be one that a financial advisor should ask you, which is, what do you want from all of this? What do you want from this relationship? What does your retirement look like? And let's help you navigate through the different challenges that might present itself through that.
What do you see most often that people make the mistake doing what? Not planning soon enough, not knowing what they want? What do you see?
I think there's a hesitation to get good advice, right? And I think some of that stems from an emotional standpoint, either embarrassment or maybe I waited too long. But there is, you want to start as soon as possible saving for retirement and for the things that come, but there isn't really a time frame that obviously each case is individual, but we feel that today is a good day to start. Every day is a good day to start seeking good advice.
That's wonderful. I mean, even if you're a teenager, learn to start putting money away. You're working in the summer, just start saving. I think the average age now that people are living is 85.
Yeah.
But they're not planning that long.
Right.
Yeah. They're not.
And every year in the future, it looks like that age just keeps on going further and further out.
That's such good news. I love that. Yeah, they're going to live to be 112. Look out, world. I'm going to be around for a while, right?
That's right.
Thank you so much. That is absolutely excellent advice. Appreciate you being here today.
Thank you.
A lot of good information we shared today. Hopefully that's information that you will share with others. Thanks for watching AARP Real Possibilities.